The drug that I will be talking about is known as dextromethorphan, also known as DXM. Dextromethorphan is under the drug classification known as antitussives, also known for allergy and cold and cough remedies. Some generic brand names is Mucinex, Robitussin, and Vicks, and its reason for usage is for cough suppressants, typically over-the-counter colds and cough medications. So, how does DXM work? Well, its mechanism of action is that it suppresses the cough reflex by a direct effect on the cough center in the medulla. Its route is PO or by mouth only, and its dosage for an average adult is 10 to 20 milligrams every 4 hours, or 30 milligrams every 6 to 8 hours. And for extended release, it is 60 milligrams twice a day, and it is not recommended to go any higher than 120 milligrams per day. When looking at the pharmacokinetics of DXM, a lot is still unknown. When looking at the route for PO, the onset is 15 to 30 minutes, the peak is still unknown, and the duration is 3 to 6 hours. For PO extended release, the onset is still unknown, the peak is still unknown, and the duration is 9 to 12 hours. How it is absorbed is through the GI tract, and with extended release, it is absorbed more slowly. The distribution is still unknown, the half-life is also unknown, and it is metabolized to dextromethorphan, an active metabolite. Dextromethorphan and dextromethorphan are both excreted by the kidneys. Surprisingly, there's not a lot of adverse effects with DXM. In high doses, it can cause dizziness, sedation, and nausea. With interactions, it can increase the central nervous system depression with antihistamines, alcohol, antidepressants, sedatives, hypnotics, or opioids. Amiodarone, fluoxetine, and quinidine may increase blood levels and adverse reactions from DXM. When administering DXM, some important nursing considerations to look for is to assess for frequency, nature of cough, lung sounds, to know if there's any sputum present, and if so, the amount and what it looks like, and also to maintain fluid intake to 1,500 to 2,000 milliliters to help decrease viscosity of bronchial secretions, unless contraindicated. The nurse teaches the client that the major advantage of antitussive therapy is A. to encourage removal of secretions, B. to relieve allergies, C. to relieve a dry cough, and D. to control a productive cough. And the answer is C. to relieve a dry cough. My last slide is just a list of references I used to complete my PowerPoint.